Hey there, Indiana. Welcome to a special Who's Left event here. My name is Scott Aaron Rogers. Obviously, you know me as the host of the Who's Left podcast and Who's Left this week on Sunday mornings. Well, tonight I've got a couple friends with me to talk about their special event this coming Saturday. The Ripley County and Franklin County Democratic parties are co-hosting this Hoosiers for Healthcare debate and fundraiser in Batesville that runs from 11 to 3, and we're going to talk about that event and sort of preview what we can expect, get excited for it. And I've got the organizers of said event here with me tonight. First, there up next to me on the top of the screen, to my right, is Ripley County Democratic Party Chair Victoria Martz. Victoria, welcome back.
Hey, good to see you again, Scott. Thanks for having us on tonight. We're excited to tell you everything we can about the Hoosiers for Healthcare debate.
It's been too long. It's good to see you again. And then my new friend, Christina Persson, is the Franklin County Democratic Party Chair. How are you? Welcome, Christina.
Hey, thank you for doing this for us. We appreciate it.
Listen, so I first met Christina, I don't know, a few weeks ago. Maybe it was the day after the No Kings rally. Brad Meyer had an event down in Salem, and it was a costume sort of, Halloween themed event. And I came as Spartacus, and I was wearing sort of this toga thing, and I was like the only one in costume except for Christina, who saved the day, dressed like a butterfly. So I didn't look like a fool. And she also set me up for a really good Trump joke. So I appreciate that as well. But hey, enough about all that. What I really brought you here for is to talk about this coming Saturday's event at Liberty Park in Batesville. So how did the idea of this Hoosiers for Healthcare debate come about?
Well, I'll tell you, we had been thinking about something different to do for a fundraiser, to be honest, for our party. And then we thought, you know what? We saw all the other local parties around us, all the other counties having their dinners, and of course, raising their money for their endeavors. And we just decided we'd like to do something different, because oftentimes the dinners aren't so inclusive because it is a fundraiser. And we felt just right now that we need to bring people together and, to fight the good fight. And so we decided to try to figure out a plan to do that. And the debate idea came up. And then the idea of focusing on healthcare, because that's one of the issues that does not know party lines. We all need healthcare at one point in time throughout our lives. And of course, right now, look at what's happening. Rates are going to be skyrocketing for insurance. Folks are going to be uninsured. It's just, there's many more things that tie into healthcare. So one of our members, Jeff Wilson, he's a union guy, and he really pushed on the healthcare issue and talking about how their unions would try to fight for the worker and try to get them better health coverage. And some of the workers were finding that some of these policies, they were still having to pay huge amounts out of pocket. And so we just got the conversation going, and eventually, we thought, okay, let's see if Ripley County might want to get on board with us on this idea and see where we can go with it. And Victoria, what did you jump in here and say what you guys thought?
Well, genuinely, both of us, Franklin County and Ripley County, we're very rural counties out here. And because of that, we also tend to have a smaller membership than larger counties like Clark County might have, or Marion County, of course, that's one of our largest counties in the state. So we decided to work together on this endeavor because we are really trying to rebuild our engagement base out here. And we find that a lot of people, what they're looking for in getting re-engaged with their local Democratic Party is they want something to go do. And like Christina said, we're trying to get people more engaged civically across the board. There's a lot of people that see what's going on in our federal government in this day and age, and they are not liking what they're seeing. I mean, we're looking at the government having been shut down for the longest period of time at this point in history. And people across the board are looking at that and wondering, why are we doing this? Federal workers are suffering across the board. So something like this, U.S. healthcare is a great issue to get people from across political boundaries together on. And let's really talk about it without any kind of stigmatizing issues. We just need to talk about what we're going to do to improve healthcare in the US because it is absolutely in disrepair and we need to build the system up again. And we need to know who's running to represent us and what they stand for before we go and vote next year.
Yeah, exactly. That was a big factor for us as well because, I'd heard so many times, oh, Democrat candidates, they all stand for the same thing. No, they do not. Everyone has a different idea of how they're going to solve certain problems and a different way to get there. And some don't want to address problems at all. So the debate is a perfect way to get these candidates out there and, accessible to the people. Sometimes they're not as accessible. They'll come to Democratic functions, but, we don't get to see all the candidates all the time. And quite frankly, as Victoria said, we have problems with people being engaged and involved. Not because they're not passionate about what's going on, but just because many people they don't want to be in party politics or party activities. They want to just fight the good fight. And so we accept everyone, that wants to have a better quality of life and wants to fight for that. So, yeah.
So it's I mean, certainly healthcare is an ongoing concern for Americans. I mean, we all know our healthcare system is it is patchwork. I guess would be a generous way to describe it. It's every other country in the industrialized world does things a certain way in terms of universal health care, and there's different ways of going about it. But only the United States stands out in our way of doing things. But right now, specifically, with the government shutdown going on, ostensibly the reason Democrats are refusing to give Senate Republicans their votes is over healthcare. It is over the Affordable Care Act subsidies. Now, when you guys were scheduling this, when planning this, did you know that this was coming?
I mean, no way. Yeah, I didn't. Did you?
No,
Victoria?
we scheduled this back in, I think it had to have been August when we started making the base plan for all of this. So that was 3 months ago that we never could have foreseen that this was going to happen. I mean, they had already made significant cuts to the federal budget for ongoing funding of the Affordable Care Act tax credits earlier this year during the budgeting session. So that had already been cut. And, I appreciate that Senate Democrats are fighting to ensure that that program gets funded because out here in rural Indiana, we are really going to suffer if they do not continue to fund those ACA tax credits for people to be able to afford health insurance through the federal marketplace, which is where a lot of people are getting their health insurance these days. If you work any sort of gig economy job, if you work as an independent contractor, if you work for a business where you're not working full time, so they're not required to give you any sort of personal benefits, you rely on buying your own health insurance coverage. And if you're working any one of those number of jobs, you're probably not making enough to afford it on your own without some form of assistance. So It's really, it's terrible that they're pitting it against feeding our most vulnerable populations at the same time. And I'm just really proud of the people out there who are standing up to make sure that their community members are provided for through it all. So we can kind of like a ongoing strike for labor rights. We can all stick together and not cross that picket line.
Yeah, most definitely.
Yeah, about that. And listen, I want to focus and keep the stuff on our focus on Saturday largely, but I'm hearing that there's sort of a group of quote unquote centrist Democratic senators that are maybe thinking about crossing that line, as it were, and helping Republicans reopen the government without any guarantee of these subsidies keeping through or going into effect. What do you think about those folks, Christina?
I'm going to tell you where I'm coming from on this. When I was younger and first married, I lived in Sweden and I had health care. And, as a cocky American entering a country that was governed by a social democracy, I thought I knew it all. I thought that our country was the best, that we had everything. You know what? I never paid over $20 for any medical procedure that I had done. I did not have to wait for anything. It was top-notch healthcare. And then we come back here, my husband and I came back to the States, and, we were constantly trying to figure out how we could afford a health insurance policy because they were pricey back in the 90s for us, even being young people. It was crazy to go from, a health insurance system that was based upon your income and the taxes. Folks say, oh, they pay so much taxes, but you get so much, and it filters through everything. Like your car insurance is lower because you don't need the medical liability if someone's injured because you have national health care. Just crazy connections like that. But no, when we came back here, I realized, listen, I want this for our country. With that said, I mean, that's why I say it's so important to have a debate and see where candidates stand on the issues. And right now, we have this crossroads that we're at in this country, where healthcare is going to be ripped from people's hands, their ability to have healthcare because of the cost. And people can stand up right now and say, no, enough is enough. It's time to change the system. And I hope that our candidates will stand by that.
And I tell you, I just want to go off of what Christina's saying. These U.S. senators, they are getting their salary still. They're still being paid. They still have health insurance coverage. So you know what? Get out there and join the picket line. Don't be talking about how I'm going to go in there and I'm going to compromise just so I can look a little bit better in the news cycle. No, get out there, get working with your community. You have a well-recognized name. You have a well-recognized face in your community. Get out there, get volunteering at your local food pantries, get volunteering at your local soup kitchens while you're still getting your full benefits, packages, and salaries. It's insane that anybody would talk about crossing the picket line when their life is perfectly fine. They're just worried about the next election cycle.
Exactly. And, we look at examples. We see, Bernie Sanders is out there doing the good fight constantly. He's with one senator other than AOC that I actually see earning their paycheck. I hate to say it, but in my opinion. So
yeah, there are, there's a few out there, but not nearly enough. And let's talk about that. That is kind of the headline act Saturday is this debate. I assume that, that's what we will be talking about, is getting these candidates on the record and seeing sort of where they stand in that debate. So obviously, we will talk about, it sounds like we're talking about universal health care or Medicare for all. I assume that topic will come up. But what other kind of healthcare related topics are you hoping to hear discussed Saturday?
Victoria, you want to run with this first?
Sure. So a big, big concern for us out here in rural Indiana is how are we going to make sure that our rural hospitals continue to receive enough funding to remain in business? If we're not doing universal health care, we got to make sure that we are making the citizens of rural Indiana insured under health insurance in some capacity, whether it's through tax credits through the ACA or HIP or some other form of health insurance coverage assistance. Because when people are uninsured, rural hospitals shut down. Because when people are uninsured, they go only when their medical issue is at an absolute pivotal point. They put it off unless they believe themselves to be practically dying. That's when they go. And emergency medical costs are the most expensive medical costs. Medical costs dealing with permanent health issues, chronic illnesses. Those are the most expensive forms of healthcare. And if we're not ensuring that our residents are fully insured, they're going up and they're running up that bill. Hospitals aren't getting reimbursed because if you didn't have enough money for health insurance coverage out of your own pocket, you don't have enough money to go pay that exorbitant bill. And then healthcare facilities are having to shut down because their bills have run up too high. Their providers are not making enough money. They don't have enough profit to continue going on in business. And that's why we see hospitals shutting down, why we see delivery wards in rural Indiana shutting down. One recently shut down out in Lawrenceburg, Indiana, at St. Elizabeth Physicians in the last year or two here. And that means that women of my age range here in rural southeastern Indiana, we're going to have to drive over 45 minutes to an hour to get to an actual birthing facility. And that is dangerous because everybody's birthing process is different and you can run into complications like that. And mothers' lives can be on the line and unborn children's lives can be on the line. So it is really essential that we make sure that rural Hoosiers are insured in some capacity, whether it's through federally funded assistance, state funded assistance. We need to have our residents insured to make sure our medical facilities continue operating.
And we need to improve our medical facilities. I having had dealt with cancer last year. I was that person that Victoria just talked about. I put it off. And by the time I went in and I had problems that I couldn't avoid anymore, I was already stage 3. It had transferred into my lymph nodes. And, so of course, more surgery, more chemo, more care. And the frustrating thing that I discovered through at that point, I was unemployed and I was on HIP. And what I discovered through HIP was that the specialists in my area, the waiting list or the time to get in to see someone was, my gosh, not just weeks, but sometimes months. So there you sit, hoping, that it doesn't spread, So I ended up going out of the rural area and traveling to Indianapolis to get more expedited care. Not everybody can do that, and I had a support network of people that helped drive me, to treatments and for my surgeries. But we've got to do something, not only to save these places, but to also improve them and improve healthcare in the rural areas in general. We just
Absolutely.
do. Yeah,
Well,
we're in this place where we're pushed into such a corner, right? With the shutdown and everything, it really illustrates it. We're fighting over scraps. We're fighting over, please let us have our food subsidies. Let us eat. Let us let us have the half measures that are Obamacare subsidies, right? It's like, let us have that little bit where what we could be having, what we could be thinking about, and the things I hope we are talking about Saturday is the reimagining healthcare in this country entirely, where it's not a commodity, where it's not something to be bought and sold. It's a service to be provided for people, where we're not like fighting to hang on to the little rural hospitals that we have and to keep the services that they have, but to like build more rural hospitals to like serve people where they're at, like rural communities like out there in southeastern Indiana. It is inherently inefficient to serve people that are spread out. Capitalism doesn't like inefficiency, so it will close those things that are inefficient. And if we look at healthcare through this capitalist lens, through this lens that it is a commodity, we're always going to get into situations like that where people who are not in a situation that is convenient for capital to get the care that they need.
Well, and you see the parallel with healthcare and education, because now we've got a situation where, for many, many years, certain rural schools would shut down. They would, gather the students in a more central location, just constantly education changing. And now it seems as if, the more private sector educational institutions are going to be able to get money that the public schools had acquired before. And so what's going to happen to our public schools now? It's will the rural communities get to the point where the main option for good quality education ends up being a private school instead of public?
And even then, right, there's still that gap with those private schools where it's going to keep out,
certain people.
People, and we all know the certain kind of people that they want to keep out of the private schools. I mean, you don't have to be Fellini to figure that out. So, so I want to talk about the lineup a little bit for Saturday's debate. It's not just a Democratic event. I mean, you guys put this thing together, but we've got an independent candidate in there. You invited the incumbent Aaron Houchin. Why not? Why was this not just say closed to Democrats? Why open it up? And then following up on that, did Congresswoman Houchin politely decline, or did she just blow you off? I'll ask you that question, Christina.
Oh, well, first of all, when Victoria and I and our crew gathered, we ended up deciding that we wanted everybody included, because we just felt that it's time. This is a time in our history that's different than any other. And, yes, we are Democrats. Yes, we are leaders within the Democratic Party organization. But we feel that the people deserve to be able to see their candidates, regardless of the party they belong to, and really ask them the hard-hitting questions and demand answers, and demand that they are truly public servants if they take office, that they will serve the people. It's all about that. Now, in my opinion, and I can't speak for Victoria, but I think we have some good candidates on the Democratic Party side. And I'm hoping that they'll shine in this debate. Sort of a gamble. But we'll just see how it turns out. Victoria, what do you think?
Well, yeah, I just agree with everything you said there. Absolutely. Our goal, so we originally had thought about doing a Democrats-centered event, but then thinking about just the work we are already doing of trying to rebuild our Democratic parties, we're really looking for across the political spectrum engagement here. We have heavily, our communities have a lot of
Yeah.
independence in them. If you talk to them, they don't necessarily tell you straight up, I'm an independent. They'll say things like, well, usually I vote Republican, but then they talk to you and then they're like, what? But I really like to vote based on the person. And so I'm like, well, to me, that sounds like you're probably an independent. You're just not self-identifying as one, but that sounds like an independence ideologies to me. So we're really trying to get them engaged because genuinely, we're stuck in this two-party system right now in Indiana. You know, it's always going to be right now either the Democratic Party or the Republican Party who gets a candidate into office at the end of the day. And right now it's the Republican Party. Let's be real. It's not going great so far for the Democratic Party. But the only way out of this two-party system we're stuck in is if we can get some real ethical people into office on the either side of the ticket, but real ethical people into office who are genuinely going to push those gates open for more political parties to be engaged in the democratic process so they have real fighting chances going forward. We need to change the requirements for what it takes to run as an independent candidate so that they actually have genuine opportunities to run for office and don't just have to look at what feels like a sheer cliff up a mountain here of trying to get into that position of just being a candidate. Kudos to Floyd Taylor, or my goodness, did I say his name right? Yes, Floyd Taylor, for the work that he's done to run as an independent candidate, because my understanding is it takes a lot of signatures to get on the ballot as an independent candidate. So kudos to him for getting that done. And I'm really excited that we have all of these candidates coming together to debate each other. I was, I had some amount of hope that maybe our current representative would come engage in the debate since we were making it clear that it was open to all political parties. I will say, Aaron, we have a podium for you. So if you change your mind and you decide to come engage in this debate, we've got a podium there for you. If you're watching this live stream right now, you can tell from watching this live stream what we want to talk about. We would really appreciate it as your constituents if you would come out and talk to us about where you stand on these healthcare issues, especially while you're collecting our taxpayer dollars and enjoying lovely healthcare coverage while the rest of us aren't. But yeah, she did not dignify us with a response. They didn't say anything, but we did send them an invitation the same as every other candidate.
Exactly. And we went a little bit further in trying to, find pathways to contact her through people she knows. And, it just, nada, just a crickets in the distance from her. So it's disappointing because we really want to bring everybody together for good discussion, good debate, so that the people can see where the candidates stand. I mean, she obviously won the last election. Why did people vote for her? I'm sure the people want to know what she is planning to do if indeed she wins the seat again. What is she going to do to make things better for the people of Franklin County and for Ripley County and District 9 and the state of Indiana and the United States? What's she going to do?
Yeah.
And nobody's getting all these questions are the same for everybody. So like there's no question we're going to ask her that we're not going to ask every other candidate up there.
I wanted to ask that about like the format of the debate. It sounds like you're going to ask each candidate the same question. Or is there going to be an opportunity for them to, have a little back and forth? Is there like a audience participation kind of element to this?
So you can submit a question if you have a particular question you want to hear answered. You can submit a question to our moderator, whose name is Rachel Chatham. You can find her on Facebook. She is in the page for the event. She has shared several of the posts for the event to make sure we're publicizing it out there. But she's the one who is going to determine the final questions to be asked and is putting those together. The format is going to be we're going to try to keep it to an hour and a half total debate time. Everybody is going to be asked the same question, and each candidate is going to have about 1:15, 1:30 to respond. And then if somebody's name gets directly mentioned in a response, that person whose name was mentioned will get an additional 30 seconds to respond, since they are being directly called on to provide a rebuttal. So there will be some allowance for back and forth, but we are going to try and keep it to a time schedule so that people can hear all the answers we can fit into that amount of time to these questions and learn as much as they can about each candidate's stance on these various issues.
So Yeah, we mentioned, this is a District 9 event. What is even in District 9 going to be next year? And I wonder if things are redrawn. We don't even know the maps. They're going into special session in December now. Like, we've got these candidates who've declared their candidacy for a district that may or may not even exist, or its boundaries may change between now and then. What kind of monkey wrench does that throw into the proceedings?
I don't know, I guess in my opinion, and maybe Victoria might disagree or agree. At this point, we just need to get people up on the stage. Obviously these folks want to run for an office. If the districts change, if they're passionate enough about it, they may, adjust and continue to run for the office that's open, just in a different district. But, this, I'm looking to the future. I don't know about Victoria, but I'm seeing this as somebody needs to continue with debates no matter what happens with redistricting. We need to get these candidates out there where they're not just going to dinners for a specific party and hobnobbing with only party members before a primary. We need candidates out in the open and the people interacting with them and getting folks involved in the political process, because look at what happens when people don't.
Mm-hmm.
So Victoria, what else is going on Saturday? You said we got about 60 to 90 minutes maybe to expect for the debate. Looks like the event is running from 11 to 3, which by my count is 4 hours, which is more than 60 to 90 minutes. So what else is going on?
Okay, so this is another part of the event that kind of evolved over the beginning of planning it to present. So originally we were going to charge an admission fee for each person 18 and over to come to the event, because we were trying to fundraise for a cause, but we changed plans later and decided that it'd be better to make it open to the public to admit in general, because number one, we want as many people to attend as possible. We don't want people to feel like having to pay money is going to be a barrier to them coming to learn about who's running to represent them in next year's federal elections. And then also, the cost of living has been rising constantly over this year. So this was something we could not have anticipated, that they were going to cut SNAP benefits fully at the beginning of November. But we actually had decided in part to not charge an admission fee because we already know that living costs were very high. And we wanted to provide a free hot meal to everybody in the community who just needs a meal that day. So genuinely just coming to eat and have community with your local residents out here in Southeastern Indiana is a big part of this event. We want to encourage people across this area to just get more civic knowledge, to get more community engagement. I think that's why a lot of people go to church. That's why a lot of people join social organizations that they do. They want that sense of community, and that's something that we want to provide to them. We want them to come engaged with a community that is about something all of us need to unite around, because it is required for it to be what we want it to be: democracy. It's supposed to be a government built by the people, for the people. If we're not all meeting regularly and we're not coming together and talking about these issues and the different ways that we see them, we're not doing a service to our government that we are supposed to. And I think that's why we see it in the way that we do in this day and age, where it doesn't represent us and it doesn't represent what most of us want it to be. And so that really is the essence of those other 3 hours. I mean, part of it is we are going to have other organizations there. We're going to have a medical care provider from the community there available to answer health questions for people. We're going to have the Franklin County
Great
Health
idea.
Yes, right. They offered to do it. They're very lovely people. We
Yeah.
have the Franklin County Health Department. They're going to come out and they'll be available there to answer people's medical questions. I've actually gone and met with them in person myself, and they straight up told me, they're like, honestly, people just call me and just ask me a random health related question, like I'm a doctor, and we are more than happy to answer them for them because we are nurses. We want to give people medical knowledge, give them medical understanding, because there is so much misinformation out there in this day and age. They want to help clear up those muddy waters for people so that they can really trust what medical information and kind of know how to analyze medical information themselves and know when they maybe need to go see a doctor. So we are going to have some medical organizations out there tabling. But yeah, that's really the essence of those other 2.5, 3 hours is community building, feeding the people, and getting people engaged with the civic process and local healthcare providers.
Yeah.
Fantastic. So, I mean, you spoke to this. It sounds like more than just a debate, more than just a political event. This is a community building exercise. It shows that Democrats are active. We exist. We're out here, in our communities. We exist. We're visible. And we're a part of your community. We're out here doing things, like feeding folks. We're not the monsters you might hear about on Fox News or whatever. So, what's your read on how Hoosiers are feeling about the Democratic Party? Maybe in their areas, are they having new thoughts? Giving Democrats a second look? How are they feeling about Republicans? I know there's a lot of brand loyalty here in the state. Just in general, how are your neighbors feeling about the two major parties right now?
I mean, I'm going to base my response upon the last protest that we had in Brookville. That was also a joint effort between Franklin County, Ripley County, and Decatur County, where we went from location to location through the day, and just basically stood together for one cause. But I noticed in my own community, more folks were more receptive and more thumbs up, more honking, more. I even had one woman, we were setting up before the protest. She was walking her dog, and she asked me, "What's going on here?" And I told her it's No Kings 2 protest. And she said, "What's that?" And I explained it to her a little bit. And she said, "I've been having trouble getting my healthcare claim through. My husband passed away. She didn't understand why the process was so slow. She was concerned, about just being without those benefits. And, I just said, hey, come back and stand with us." And she told me flat out she was a Republican. And you know what? I turned around later on in the protest, and minus the dog, she was back. And she was with us. And we gave a sign.
Wouldn't you know? That's amazing.
So, I mean, I don't know. Victoria, what did you notice? Did you notice less opposition this time?
Oh, yeah, absolutely. I count opposition in terms of how many middle fingers we receive while we're out there. And I'm telling you, I think I only counted about 3 middle fingers this time around. It was incredible. There
my
was
gosh.
only one coal roll, too. You want to explain what a coal roll is, Christina?
Well, there's one gentleman in particular in Brookville that he tries to get on social media and gather people together to do this coal rolling thing where they rev their engines and they blow black smoke on the people assembled protesting. But our law enforcement in Brookville, those guys were on top of things. I felt safe protesting. They were watching out for everybody, and they handled the situation immediately. So I don't know. I just I have a really good feeling after this last protest that people are starting to come together, and I hope I'm not wrong, but that's my sense.
I think I think we will see a continued change in the way that people vote. The more that we are consistent in standing by ethics and morals to ourselves, because when we stand by those to ourselves, we're standing by it to everybody that we would be representing. When we hold people and organizations accountable within our own party, everybody sees that as a huge issue across the
Yeah.
board, regardless of party affiliation. Nobody likes to
Mhm.
see people flushing money into politics and then getting their way at the end of the day, getting to have the lighter tax burden at the end of the day. Because truly, a program like universal health care is going to be absolutely more than possible if we just tax the wealthiest 1% in our country. And it's because they are hoarding the wealth that is produced by the laboring class below them. They had 1, 2, maybe 10 good ideas,
Mhm.
20 years ago, and they've been capitalizing off of it ever since through the manual labor of their workers.
And
So,
yeah, I mean, Victoria, you're right on key there. And I'm so excited to hear you speak this because, guys, we're in the middle of a class war. I think all three of us right now, we know what's happening. And, it's almost to the point, yes, I'm part of the Democratic Party. Victoria's part of the Democratic Party. But I get kind of tired of hearing the cheerleader team mentality of, "Ooh, we're Democrats. Just vote for us because we say we're
No
Democrats.
matter who. Yeah.
Oh, yeah, I'm a Republican. Vote for me just because I say I'm a Republican." You know what? We need candidates that are truly grassroots candidates. We need candidates that understand the people. And when I say the people, I'm talking about the poor and middle class folks. Because the millionaires and billionaires, they're fine. They're not hurting. But we sure as heck are. And we need candidates that will, serve us and understand where we're coming from. And it's difficult to really accept when we keep going down the same road that we've been going on that led us to the point where we are right now in the history of our country. We got to stop. We got to do something different. And I think that's what I'm trying to do. And I believe it's what Victoria is trying to do. And we hope other leaders in the political party will follow suit as well.
absolutely.
I'll tell you what, one thing that really inspired me is to see you guys working, across county lines to do these things together. Christina, you talk about class war, and yeah, you're right. Your analysis is spot on. We are 100% in a class war, and the wealth class, the billionaire class, uses things like borders, like county lines, like artificial lines. If you look at the gerrymandering right now, the redistricting, it is penning people in with artificial fences in a way, right?
Yeah.
So then, yeah, you gotta see the guy at the gate and pay a toll to the guy at the gate to get the
Yeah.
thing, right? So that is the way that the wealth class, keeps people in their little spot. And people power is always better the more of us there are, when we can work across these artificial lines, these imposed borders, these fake boundaries that keep us apart. What lessons can maybe other county chairs, other organizers, other activists learn about the collaboration between your two groups, on this event and other events?
I mean, for me, you got to step outside of that box and be willing to try to do things differently. Because let's face it, Democrats, what we've been doing for years has not been working. And to to keep trying to push to the middle, and change, everything that we should be standing for, and basically the essence of who we should be, and to serve the people. We just can't do it anymore. We need to stand firm, on issues like healthcare, on issues like education, and just do what's right by the people. That, in my opinion, that's what government is supposed to be. They are supposed to take care of the people.
Mhm.
And, we are a wealthy nation. There's no reason why people should be having to work 1, 2, 3 jobs, at a time, just to survive. It's just ridiculous.
Right. All this AI is coming in, replacing all the jobs. People should theoretically be able to work less and have more leisure time, more free time to be with their loved ones while, all the boring jobs are unloaded onto the computers, but yet we're working harder than ever before for less and less and less. Victoria, what are you, what kind of lessons are you taking out of your collaboration with Christina and the Franklin Dems in putting this event together?
Well, I'll just say we love the Franklin Dems here in Ripley County. We love all of our neighboring Democratic parties. I haven't met anybody in one of my neighboring Democratic parties where I was like, well, this is going to be a problem. They're all wonderful people who are fighting for people first policies for a better future for our state here in Indiana. We might all have slightly varying ideas on how we're going to go about that, or some of us might be struggling to come up with the ideas on how we are going to go about that. But the more we work together, the more we have people to bounce our ideas off of, the more we have collective effort to carry pursuits like this forward and make a dream a reality. So working together collectively is really essential in a time like this. And kind of going back to the discussion of these arbitrary lines, counties, towns, districts, what have you, and also kind of tying it into what do we do if they do end up redistricting, and we've had this debate already. Well, I tell you what I hope we do. I hope every one of these candidates, they go back to whatever their new district is and they decide either, look at who the other candidate is that's running for Congress in that district for the party they were running with, and assess, is this somebody that I can get behind? Do I think that I have significantly different positions where I really need to carry this fight forward still? I still have a voice that absolutely needs to be in that congressional district seat. And if not, if it's somebody you can get behind, they stand effectively in the same place that you did on the important issues, then I would implore them to run for lower level offices. We absolutely need people to run for school board. We have book bans across the state that are in effect. Kids aren't allowed to read in high school books that I was required to read in high school. And I hated it. It was such a burden. And now I go back and I read them now and I love them. So I really want to see people get into every political office that is up for election. We need to be running for every race, because this is not going to be a one election won and all problems fixed issue. We have to fight at every level of our government to take it back, going back to who this war is really against, from the wealthy class. It is us, the people, versus the money, the powers that be, who want to rule all of our lives, who want to be the decision makers for what religion we get to have, what books we get to read, if we get access to human required things like health insurance, food, clean water, and air. No, it's us, the people, versus the powers that be, and we need to decide which side we're on, and we need to reject everything else that doesn't align with that side.
I agree.
Amazing.
Yeah, it's not a political party, one political party against another political party, in my view, at all. It's a class war, and yeah, we need to come together, and not only the people come together, but also the organizations such as the Democrat and the Republican Party in rural areas, because we're all going to be suffering from the same things if we don't start making sure that our candidates and the people that represent us are thinking of the best interests of the people. We got to come together, period, right now. And for democracy, for our future, for our future.
Yeah.
Absolutely. Christina, let me ask, what kind of takeaways maybe you would like for people from maybe outside of our district? If you're looking at, folks up in the third, up in the Fort Wayne area, or over in the region, or down in the expansive 8th district, what can folks from outside of our area take away from this Saturday's event?
I would love to see this become a trend. The Democrats, we've heard some district leaders say, we've thought about doing a debate, but it's for the Democrats. It's not including everyone. And, back in the day, there used to be town halls where many candidates would show up. And that's sort of not happening anymore. And it's sad because, how do the people in general, independents, or Democrats and Republicans, how do they feel welcome to go to one venue over another? If it's neutral, then everybody shows up. And, hey, as a Democratic Party leader, I'm hoping that some folks will come to our side to help in the fight. But if not, I'm just happy if they think that one of our candidates is a good choice for them. Even if they end up voting for a Republican in another office, for me, I just want folks to think clearly when they go to vote. And when it comes to other Democratic parties throughout the state, I just hope that they will start thinking outside of the norm and try some new things to get people engaged. And this is one way, the debate. Another way is information campaign. Franklin County, we've been doing billboards all over the area to, clue people in for the real reason why some things have changed, why some things have become more difficult for them. And, we're spending money where maybe Democrats haven't spent money before. And as far as fundraising, we're really hopeful that if other Democratic parties do what we're doing, that our members or the people of the community will help sponsor these events and help us continue to do this. So like for this event on Saturday, there will be a donation box set up. So if folks would like to see us do this again, or even just help us offset some costs, that would be terrific to throw something in the donation box. It all ties in, but
Yeah. Is there a way, for example, now if folks can't attend the event and watch the debate and the speakers and whatnot, they can turn into my feed, HoosLeft.us, and YouTube and Facebook Live and all that good stuff, and watch in live and engage that way. But if they want to help support the cause and maybe kick in some funds, is there a way they can do that without being there in person?
Victoria, tell them about that.
Yes, there is. We have a page on Act Blue that's specifically for the event. I will have to look it up and post a link maybe in the comments on this video after we're done with the live recording of it. But that is where people can go to donate remotely if they do want to contribute to the cause out here.
Excellent. Well, that's good to hear. So, we've only got a few minutes left here, and I want to thank you both for being here with me today. It's been a great conversation, and love talking to you both. But in our last few minutes here, I want to ask, just besides the spirited debate and some exciting speakers, what are you most excited about for Saturday, Christina?
For me, first of all, just getting the candidates together and, just seeing where they stand. I'm hopeful that we'll have a good turnout, even though it's in a big picnic shelter in November. We plan to have a roaring fire going in the fireplace and, other heat sources. We're going to be serving some delicious soups and, yeah, I'm just hoping that we have, good engagement, and I'm hopeful that folks will believe in the event enough that they'll help us out to maybe donate for a future event. I would love to work with Ripley County again, maybe even bring in some other counties to help, to maybe stage another debate for education, possibly. So
I
yeah.
think that sounds like a fantastic idea. Yeah, I would love to participate in one of those in any way I could as well. Victoria, how about you? What are you looking forward to Saturday?
I'm
What exciting?
really excited to meet, sorry for interrupting you. I am really excited to meet all the candidates. I have not had an opportunity to meet all of them yet. I actually have met most all of them, but I have never met Mr. Taylor and I have not met Mr. Davidson yet. So I'm really looking forward to meeting the two of them and just hearing all the things that they have to share with us in person about their positions on these issues. I also really am hopeful to see more people get engaged with the Democratic Party base in Franklin County and in Ripley County. I don't care if they want to identify as a Democrat going forward. You don't have to. Like I said, we have a large population out here who is more like an independent voting base. And I would just love to see them get engaged so that we can help run these campaigns into this next election year as effectively as we possibly can. Hopefully, flip some of these seats at the state level and the federal level and the local governmental level so that we can actually make some real, effective, accountable change within our governmental structure across the board and really just create more better elections in the future by doing it. We really need to join hands at this moment in time where our democracy is under attack every day in a new way. We need to join hands right now, regardless of party affiliation, take back our democracy and get people into office who are going to be accountable to the people they represent.
Fantastic. Let me go back to you, Christina. Where can folks learn more about the Franklin County Democratic Party? Maybe help you out, volunteer, donate, all those good things. I bet you got a presence online.
Yeah, we really depend on Facebook. It's the Franklin County Indiana Democratic Party. We also have a public page on Facebook as well. And then you can get our information from those venues. We also have an email that you can find on the state website for Indiana Democratic Party, as well as a phone number to call. And we're working on a website, so hopefully
Yeah.
we'll have that up and running. But we do have an Act Blue account as well under Franklin County Indiana Democratic Party, and we're hoping that more people will become engaged and involved, just not only as candidates, but also as precinct chairs and vice chairs, township trustees, town boards, the whole 9 yards. We're hoping that folks will step forward and just help us to become a more
Yes.
balanced organization that actually can, stand up for the people of our community and get some things done. Yeah.
Yes. Your community needs you. Get involved in whatever way you can. Victoria, how about the folks in Ripley County? How can they find you and get involved?
We are pretty much available on the same platforms here. So we are on TikTok, we're on Instagram, and we are on Facebook under Ripley County Democrats. I think it might be of Indiana or Indiana Ripley County Democrats. It's one of those two.
You're Democrats of Ripley County,
Yeah.
Indiana.
Thank
Yes.
you. Thank you so much. You know it better
I
than
defined
I.
it myself so I can tag you in the promo for this video.
That's right. That's it, Scott. And we are also on Act Blue as well under the Ripley County Democratic Party there if you want to make a donation to us there. And yeah, just one thing I want to shout out there. This has nothing to do with the Hoosiers for Healthcare debate, but I got a live platform here right now. We need somebody to run for Indiana House of Representatives in District 67, which is my neighboring House district out here. It covers Madison, Indiana, Jefferson County, a lot of Ripley County, and I'm not sure what the other county is, but we really need somebody to run in that district. So if you're somebody in the Madison, Indiana area, you feel it incumbent upon you to make your world a better place, I would ask
Yeah.
you to please stand up and say your name and say, I'm going to run for Indiana House.
Victoria needs a campaign buddy. All right.
Mhm.
Hey,
Yeah.
last question. So listen, I'm going to be out there in Batesville with you on Saturday. If I were to maybe bring my lovely wife along with me and make a day of it, where is the best place to get dinner afterwards, Victoria?
So you said that because I said activity earlier. I said bring a skateboard and go to the skate park. But the best place to go for dinner out here, I mean, like I said, we got some great Mexican food out here at El Toro's and Tacos to Go in town here. But we are actually very well known in this community for our fried chicken out in Oldenburg, Indiana. We got Wagner's Inn and the Bra House. Wagner's Inn
Okay.
has won
Mhm.
some national awards. Is that right,
Yeah.
Christina? Yeah.
Yeah.
They've won some national awards for their fried chicken out there. So I would highly recommend you go check them out. I also am always a big advocate for Bra House because they got sauerkraut balls, and sauerkraut balls just, they make me so
Oh,
happy.
okay. Well, to see
Yeah, they have a
now,
good
now
pork
I'm
schnitzel
torn.
too. Yeah, they have a good pork schnitzel too. But I mean, I've been to Little Charlie's in Batesville. I've been to that little they'll probably be closed by then. Is it the Hobo House or something for
Oh
breakfast?
yeah, Hobohas. Yes.
And a Hobo Hut, and then I believe the golf course even has a restaurant there now. There's little Chinese buffet, lots of places.
Little town, lots of options.
Mhm.
Good to have options. All right, listen, it's been so fun to talk to you both. Victoria Martz, Christina Persson, thank you so much for joining me tonight. Everybody out there, hey, listen, I'm bad at the part where I remind you to like and subscribe and do the shameless self-promotion stuff, but do please follow me online at HoosLeft. That is my handle on most of the places. And subscribe over at whosleft.us. All right. Hey, see y'all Saturday. Until that time, though, love each other, Indiana.